So for anyone who's self-isolating at the moment because of the COVID-19 pandemic, we understand that you're going to be feeling very anxious and very panicked at this time. Again, that is a really normal way to be feeling. Most of us are feeling that regardless of whether or not you're having to cope with any conditions or health, disease, diagnoses. So we understand that if you've got a diagnosis of cancer specifically and you're being told to self-isolate at home, it's really normal that you're going to feel panicked and anxious. There are definitely things you can do to try and address this and help you whilst you're based at home. So, like I said before, your daily routine is really important. As best as possible, make sure that you're waking up at the same time, going to bed at the same time, trying to have a good sleep pattern and planning your day so that you've got a good routine and you know which activities you're going to be doing when, which will include exercises and physical activity, whether that's at home or whether that's outdoors, but observing social distancing advice and making sure that you're 2 meters apart from other people. Getting outdoors at this time will really help your mental health. It will help you in terms of your feelings of anxiety and low mood if you're feeling that. So make sure that you do try and do that where possible, but being mindful of all the social distancing advice that's being given. Again, it's really important to think about avoiding triggers for mental health when you're experiencing any anxiety or low mood during this time of the COVID-19 pandemic. So again, think about avoiding social media or WhatsApp threads or any of the messages you might be getting that is causing you distress. Sometimes it's difficult for us when we're overwhelmed with information, which at this point in time there's lots of different advice that's been given about what to do in the COVID-19 pandemic. So please, where best, do contact friends and family and do be in touch because that social interaction will help, but avoid any social media or any messages which are making you feel more distressed than normal. The other thing to think about is activities that make you feel happy or will help you feel less anxious. That is going to depend on individuals. Different people enjoy doing different things. So it's worth spending some time thinking about things you can be doing at home that really help you to feel relaxed or to feel happier in yourself. Whether that's doing gardening in a garden if you've got one, or you can even do gardening even if you don't have a garden where you're doing plants and other things. It could be a case of doing crafts, it might be reading, it might be listening to music, it might be watching films or television. It might be creating new projects for yourself. Depending on the individual, it will depend on what kind of occupations you really enjoy doing and that help you in terms of your anxiety and if you're feeling any kind of low mood or panic. There's lots of opportunity for physical exercise at home, which is what we're going to be showing you in other videos, or it might be that you're doing yoga or some more kind of gentle breathing exercises. There's lots of things, and all of these types of activities will really help at this time when people are feeling particularly anxious because they're stuck at home and they're self-isolating during the COVID-19 response. So you might feel at the moment, whilst the COVID-19 pandemic is happening, that you aren't able to ring and speak to your clinical nurse specialist or your doctor because they're busy doing other things. That's not the case. At this time, more than ever, it's really important that you get in touch with your GP, your doctor in the hospital, your clinical nurse specialist, or any of the other healthcare professionals involved in your care and talk through any worries or concerns you have. They'll be more than happy to speak to you and they'll be able to reassure you and give you any information that you might need at this time. Also, if you're part of the Prehab for Cancer programme, you can speak to your instructors and they'll be able to give you some guidance and advice and support you as you're needed. But equally, it's really important to use what networks you already have. So if you've got good friends and family that you can speak to at this time to help you deal with any anxiety or worries or low mood, then that's also really useful.